I hope that we have a farm bill before September 30th. I heard what Tim had to say about the October 1 date. A farm bill on time, which is already late, would be a great benefit. It matters to the certainty for farmers' abilities to talk to their bankers, to know what the programs are. And from a Kansas perspective with our drought, the lack of livestock programs, disaster programs, is a real problem. And in the absence of completing a farm bill, the absence of those indemnity programs on the livestock side will continue to exist. We've got to get that turned around. In addition to the farm bill, we continue our efforts in regard to the lesser prairie chicken, trying to make certain that we do all the things to assist folks who want to solve that problem without getting it listed. And that matters greatly, not only to agriculture, but oil and gas, to the state's economy. And we'll continue those efforts. We were successful working together to get a delay in a decision until March. A delay is not a solution, but it gives us more time to try to find that solution. Probably the more difficult issue that we face that affects agriculture producers, particularly on the livestock side, but all of us, is the need for changes in our immigration system, the ability to find the necessary workers in our communities and industries and businesses across our state, and particularly in the livestock sector, in both production as well as the ability to process agricultural products into food. And finally, let me highlight an issue that I don't think is necessarily front and center, and you wouldn't think about talking about it necessarily at a Farm Bureau breakfast, but our delivery of health care in rural communities across Kansas is under attack. We have 127 hospitals in our state. More than 80 of them, nearly 90, are what has been designated as critical access hospitals. They get a different reimbursement, presumably, not really, but at least in theory, based upon the cost of providing that service. This is a lot like rural schools, in which it costs more per pupil to provide education who are in a small school. Just the efficiencies, the magnitude of the number of people that you take care of means that the per pupil, in this case, the per patient cost is higher. And so a long time ago, we were successful in getting a program designed for small rural hospitals. Had to meet certain criteria, less than 25 beds, an average length of stay of a certain amount, no more than a certain number of miles between your hospital and the next hospital. And that's been successful in the sense of keeping healthcare delivered in rural communities across our state. If we lose our hospitals, we lose our physicians, if we lose our healthcare delivery system, we lose our communities. Young families don't take the risk of raising their kids in a place in which they can't access healthcare. Senior citizens, I can see it in my own family's life. My sister and I would have had a conversation with my mom and dad about, it's probably time for you to move to wherever there's a hospital and a doctor. And the Obama administration budget and a recent report by the Inspector General both attack this designation of critical access hospitals. Senator Roberts and I are fully engaged in this topic, and we'll do everything we can to make certain that that's not the end outcome. But we need Farm Bureau, commodity groups, other livestock and agricultural groups to join us in our effort to make certain that this does not become the law of the land, because it will mean already our hospitals in most communities across Kansas are operating on a thread. And in the absence of this designation and the money that comes with it, many of them will not be in business, and it will change the landscape of Kansas in a dramatic and devastating way. We would welcome your help in this regard.